Well, good morning, everybody. It's a great pleasure to be here. I was here at the forum last year, and I must say that it's very exciting to see what has changed in the last 12 months, and I think was also terrific to see Karen Lee come back to us and also to highlight some of those changes that have happened in New South Wales. And I'm very much looking forward to Fit New South Wales in the years to come as well, because I do think it's a good opportunity to come together as a diverse and important group of stakeholders on from our different perspectives, but with common goals. So my job today is to talk about the New South Wales Healthy Eating and Active Living Strategy, which was released at the end of last year. And I think that what we've tried to do with this document is to bring together different government perspectives in relation to healthy eating and active living, and from a health perspective in particular in relation to the prevention of overweight and obesity. So just in terms for this group, I'm sure I don't need to say that overweight and obesity is an important public health issue in our community, both for children as well as adults. The data suggests that, well, we can see that there's been an increase over some decades, but that there is some sense that the prevalence of overweight and obesity is starting to level off in adults, and we're hopeful also that that trend is also being seen in children. But of course, today's focus is particularly around physical activity, and this slide shows that we have been seeing increasing levels of adequate physical activity amongst adults, but again, just some tailing off in terms of the difference between men and women. So for males, it's around about, close to 60%, and women close to 50%. So even though there has been some improvement over time, there's still, quite a lot of gain for us to be striving for. So that's where the Healthy Eating and Active Living strategy comes in. It is a cross-government plan, and it does relate to targets that are in the state plan around child and adult overweight and obesity, but it also brings in some of the other government agency targets as well in relation to participation in sport across the community, as well as mode share of walking and cycling trips, as we've just heard, and increasing public transport journeys. So it brings all of those government goals together into one strategy. It also ties in the National Partnership Agreement on Preventive Health, which is a really critical source of funding for, particularly from the health perspective, in relation to our initiatives to address overweight and obesity amongst the community as a whole, and particularly young people. As I mentioned, we have seen this increase in the prevalence of overweight and obesity over some decades, and there's very much a strong understanding that there's a whole range of reasons why this is happening, and that it's about the social, environmental, and technological changes that have happened over time that have created the preconditions, I suppose, for this phenomenon. And so, as such, for us to work effectively in this area, we need a whole of government and a whole of system approach. We can't just focus on individuals and their health-seeking behaviour or their health-promoting behaviour. We also need to look at the environment and the supports that are available to people to make that happen. So with our strategy, in terms of there are four main strategic directions. The first is focusing very clearly on the environments that, both from a physical activity as well as a food perspective, in terms of what we need to put in place to have a supportive environment for the population of New South Wales. We've heard earlier around the planning reforms and the inclusion of health as an objective within those reforms, which we're very excited about, and we've also just heard in relation to cycling and walking strategies from the Transport for New South Wales perspective. These are really critical underpinnings for a community-wide and sustainable and quality approach to improving healthy eating and active living in our society. We also, and I won't dwell on this, but within the strategy there's also a focus on food environment. So we're looking at both the physical activity and the urban design elements in relation to that, but also about the availability of healthy food, which then supports people's choices in that area. And we've got an example in New South Wales already in the menu board labelling legislation, which has actually shown that with the provision of information about kilojoule content in fast foods in particular outlets across the state, we've actually seen a reduction in the purchase of kilojoules from those venues, and I think that's again just one part of a broader picture that we need to put in place. The area where the New South Wales Health is taking a really strong lead is the second strategic directions, which is around statewide programs. I'll talk a little bit about this in terms of what our sort of main sort of focus is at the moment in terms of implementing the strategy. But that includes the Healthy Children Initiative, which is working in a number of settings which impact on kids. Also the Get Healthy Information and Coaching Service, the Healthy Workers Initiative, and also the Aboriginal Knockout Health Challenge. Now, these programs integrate both a healthy eating component as well as a physical activity component, and I'll talk a little bit about each of those programs and their progress, because I think one of the things that we're very fortunate in New South Wales and in fact in Australia at the moment is that under the National Partnership Agreement for Preventive Health, we have unprecedented resources to support truly evidence-based programs that we can implement at scale, and so therefore have the potential to make real population health gains. And that's a new phenomenon for us. We haven't had that opportunity at such scale before. The fourth area of the strategy is in relation to service delivery, and there are a range of government services where, and particularly health services, that's probably the most obvious place where we can integrate advice about healthy eating and active living into that routine service delivery. And clearly in the health system, we have clinical health services as well, which support this work. And finally, the fourth strategic direction relates to education and information. So we think that it's really important that we have integrated and consistent messages, and that we, because there is such a range of activity that's happening across the state, we think there's a real opportunity to bring that under one banner to have a bigger impact in relation to that area as well. So I'm going to just talk briefly about the Healthy Children programs, the statewide programs. So that sort of relates to strategic direction 2. And I think that in terms of that concept of implementing at scale, just a few little highlights that we're working with childcare services, and so far we've got close to 80% of services across the state participating. So the reach there, I mean, it's probably around about 68% of children in this preschool age or early childhood age attend some kind of formal care, and so the potential reach of this is around 382,000 children. So very high reach in terms of those programs. In primary schools, to date, we've got about 66% of all schools participating, and so currently around about 750,000 children, but in the future, by this time next year, probably closer to 900,000 children and their families who are participating in these programs. And I'll talk a little bit about the sorts of changes that we're seeing in relation to that. We have a treatment program called Go for Fun, and to date some 3,500 children and their families are participating. So we're getting great reach from these population programs that we know from evidence are effective. But we're also monitoring the practices within those settings to see what's changing. And in terms of some of the treatment program, for example, we know that for those children who are going through the program, that they get outcomes such as reduced waist circumference, they're increasing their physical activity and reducing their screen time. So clearly there are positive things happening. We're also, and this work is led through the Office of Preventive Health and under Chris Drissell's leadership, looking at some new initiatives in the junior community sports area. We're moving into the area of supported playgroups, so for more vulnerable families. We will also be working in the high school canteen space and looking at infant early childhood parent support. And I'll also mention too that active travel to school is one of the areas that we're looking to develop. develop, and also we're developing a physical activity challenge program, and this might sort of seem like a strange thing. It's a virtual walk around the world, but to get from one place to the other you actually need to do the physical steps as well, and that program will particularly focus communities with high Aboriginal populations, and it will be built and connected into the social science or the social studies type part of the curriculum, so it's about travelling to cultural sites around the world and within Australia as well, so we're quite excited about that. So just to give you an idea in terms of, and I know you probably can't read the practices down the side there, but it's to give you a sense in terms of the work in childcare settings and also in schools. There are a number of practices that we know through evidence will lead to supportive environments, but also changes to the physical activity and nutrition behaviours of children. So the sorts of things that in the childcare setting that we're looking at that have a physical activity perspective includes things like having a physical activity policy, looking at reduction or limiting screen time, providing opportunities for children to be active. In the school setting, also things such as use of or developing fundamental motor skills and so on, which we know when kids are confident and can undertake those really basic fundamental movement skills, they're more likely to be active as they're older. What we're aiming for in the programs that we're working within is that 80% of the services actually meet 80% of all of those practices. And you can see that we're travelling quite well, and the benefit in terms of monitoring this is that we can then look at, well, where are the places that we're not doing as well as we'd like, and what do we need to do to encourage further change within those settings. So in terms of the adult area, probably the most exciting and biggest new development is in relation to Get Healthy at Work, which is a workplace-based intervention, which again you can see from this that the scale of this is very big. We're looking at working with more than 50,000 businesses and reaching more than 1 million people across the state. This program will have two components, both a health check for individuals, but also working with businesses to look at the creation of healthy environments to support worker health, and part of that will focus on physical activity and also active travel to work. So this is new work which will start to roll out. We're doing piloting work at the moment, and that will start to roll out towards or from the middle of this year, and again led by the Office of Preventive Health. Many of you may be aware of the Get Healthy coaching service. There's been some 25,000 people who've been through the service to date, and we know that people who go through that program have success in terms of weight reductions, but also increases in physical activity. And finally, the Aboriginal Knockout, which last year worked with some 30 towns and communities, or over 2 years has worked with some 30 towns and more than 1,600 participants. And we can see some good outcomes there in terms of body weight and waist circumference, but many of the town teams have a very, very strong focus on physical activity. As I mentioned to begin with, this is not the sort of issue, so increasing physical activity, improving healthy eating and reducing overweight and obesity is not something that the health system can do on its own. And the strategy actually does bring together a range of other agencies. So the Department of Education and Communities, for example, will continue its focus on the curriculum and health PDHPE. They're also supporting us in the school-based programs, and Sport and Rec has a particular focus on community sport. We've already heard from Transport for New South Wales, and the significant work that they're doing, which is about the structural intervention, which I think certainly from a prevention perspective, that's incredibly important that we have both people, the focus on individual behaviour, but also the structures that are in place to help people to do that and to make those healthy choices, easy choices. The Department of Planning and Infrastructure has a role in relation to urban design and urban space, and we're very keen to keep working with planning and infrastructure in relation to what next from the inclusion of health as an objective within the planning reforms, because if we have it there as an objective, we really need to seize the moment and look at how we can then translate that into change. We're working very closely with WorkCover New South Wales in terms of the Get Healthy at Work program, and the New South Wales Food Authority has responsibility for the menu labelling work, which I mentioned before in relation to the regulatory review of that. There's a range of strategies that we've got in place to monitor and evaluate the work that we're doing, and I'll just mention that in your packs you've got 2 copies of these snapshots, which are a really succinct way of describing the work that we're doing on that programmatic level. And I think, again, I would like to reiterate that programmatic approach can only be it can only bring us success to a certain point, and that it's in fact the contribution of the other government agencies plus our NGO partners that will help us make those real changes that we need to support that individual behaviour. So, as I mentioned at the beginning, we do have a sense that overweight and obesity is starting to stabilise, both amongst children and adults. From evidence, we know that, we anticipate that with the Healthy Children Initiative, that we will see a 0.5 to 1% reduction per annum, and we have a project that was undertaken in the Hunter, New England, which showed that scale of impact for a very similar approach, and so we're now scaling that up at a state level, and so we do have that evidence to support that what we're doing will make a difference. Clearly, we're very proud of the work that we're doing to date, but there are certainly other areas that we can do more in. Integrated communications and a strong social marketing campaign is a gap for us at the moment, and something that we're working on. We think there's a lot of opportunity in terms of other government agencies identifying and referring people to some of our statewide programs, because they're resources that exist and which we know will work. We will be looking at the opportunity for incentives, and I was struck by the concept of incentives in relation to schools and their travel plans and whiteboards, for example. So things like that I think might actually be useful for us to consider as well. And then finally, in terms of food environments, which is a separate issue to this, but I will just give a slight plug for our food forum, which is happening on the 11th of March. And again, there's a brochure in your packs which talks about that. And that's all.
Thank you very much.